Hello, my name is René Assink and I'm over 25 years now teacher for the Boral Institute and would like to introduce you to the NMAA, so the new Manual Articular Approach program. This program started with Jean-Pierre Boral. You already know him maybe. He's an osteopath and registered physical therapist from France. He initially developed visceral manipulation, a manual therapy focusing on internal organs of the body. In addition, Jean-Pierre Boral and Alain Grabier, also an osteopath from France, developed several therapy techniques and also the neural manual manipulation. Jean-Pierre Boral continues studies in clinical work, combined with Alain Grabier. Scientific information led to the development and practice and teaching of the Manual Articular Approach, focusing on the joints of the body. They have authored numerous books for healthcare professions, including also visceral manipulation, manual therapy of the cranial nerves and peripheral nerves, also for the vascular system. Also very interesting book is the Understanding the Message of the Body, which discusses the importance and the link between the organs and the emotions and health. So NMAA is a soft hand-on manual therapy modality that applies a comprehensive approach to the treatment of the joints. NMAA treatment is a comprised or precise gentle engagement and soft tissue mobilization of the associated bones while looking at direct and indirect relationship between bones and the body. So that's a part of the new. So we have a focal attention and a global awareness at all time. Particularly refers to the joint of the body, which are critical points of interconnectivity between all other structures within the body. Joints receive and emit messages with other parts of the body and even connected to your emotions. So NMAA integrates all these aspects of the joint, including the nerve, artery, bones, capsule, ligaments, everything that belongs to the joint and everything that has to do with the joint, as well even as the visceral and emotional connections, and that's in a certain way new. So you can say NMAA delves into the joints like you never did before. The joint is so much more complex than a place where bones come together. It's comprised of multiple components, including bone, cartilage, like we said before, muscles, tendons, nerves, fluids. Then when functioning properly, it allows the joint to glide smoothly and pain-free. So the gliding is very important. If one component becomes problematic, the entire joint begins to compensate and not function very properly. This can lead to a dysfunction or a lesion ranging from temporary pain to long-term damage. All the parts and systems within the body are interconnected, joints included. And when there is a dysfunction in one place, other areas can be negatively impacted. A skilled NMAA practitioner can properly assess the interactions of the joints with your body to help to restore the proper function. The cause for a problem can be located somewhere other than where the symptoms appear to be present. As we know, the symptoms is not necessarily viewed initially as the most important element. A symptom, perhaps pain in a particular joint, is to be considered as a piece of a puzzle within the context of an NMAA therapist patient's evaluation. So it's not only the pain. As the source of the problem is released, the symptoms will start to decrease. An NMAA therapist identifies the source of the disharmony of the body, as well as how and why it is impacting on the joint where the patient is feeling symptoms. And his main instrument is the listening of the body. So he listens to the body. Through application of a gentle and specific NMAA technique, the patient's body overall becomes less bound by dysfunctional patterns. releasing the affected joint, and ultimately allowing the body to achieve a state of optimal health. So we talked about different levels, and what levels do we have? We have 7 levels. And the first levels is the levels of the bones, the shapes, the geometry of the joints, axis planes of motions. And this level of organization is linked to the shape of the bones that make up the actual skeleton. The second level is the gliding level, as you know. The gliding apparatus and the surfaces. Cartilage have no arterial blood supply. Synovial membranes. But also on occlusions you have this gliding aspect. The third level is the stabilization level. Capsule, ligaments, limitation of movements. And if we go a step further, on level 4 we have the animations. The muscles make the joints move. Motor commands and give us stabilization and mobilization. If we go from more inside to more outside, on the 5th level we have the cohesion level, the facial level. Connection, independent, continuity, how are they connected? And also we have the long levers coming more and more in. On the 6th level we have the information, the neural layer, and all these facets that we have, because everything is connected to the brain. And on the last level, the 7th level, we have the maintenance, the vascular component, nutrition, maintenance, recovery. So now what do we need to treat? We treat anatomical structures. That's very important. And we have to have a very exact contact with them. We work with little pressure and avoid pain. We want to have a positive input to the brain. Repeat treatment until normal listening occurs, but because the listening is a very important, most important instrument. So if we see how we examine the body, of course we use tests like a lot of other therapies or medicine also use, but the most important thing for us is the listening. And so the treatment also goes a lot on the listening, on the follow the listening, because the listening shows us the way and we only have to follow it. And if we are on this following level, we do induction and we encourage the body to say, it's okay what you're doing, show me what is to be done. But also we have to compress and we have to decompress. We have to mobilize and we have to work with gliding, elongation and stretching. So what are the course highlights for NMAA? I already said it before. You're going to delve into a joint like you never did before. You're going to work with soft tissue mobilization, explore the relationship between, take for instance the visceral and the joints, but also the brain and the joints. Discover how the joints receive and emit messages with other parts of the body, as well as the emotional connections. Learn how to evaluate and treat each major joint in the body. That means each joint in the body. So I explained to you now a lot what NMAA is, and now I'm going to give you a small demo. I'm going to show you a few techniques on the lumbar spine and to bring you a little bit nearer. So I asked my patient Barbara, who is here waiting already. So what we said, the first thing that we do when we start a treatment is we do a listening. And the listening we do a general listening starting from the head, or we do a local listening when we want to be a little bit more close. Also a more local listening comes from the middle. We can use instruments like inhibition you're going to learn. If I have a listening going to the lumbar spine, take for instance L2, and I put my finger on it, give a very slight compression or a following, you feel that the listening is disappearing, and you know that you're on the right point where you have to work. Okay, if you lie down. So we said we're going to treat, as an example, the lumbar spine. We had a listening going to the lumbar spine. We had a listening going to L2. We have different approaches to that. I'm going to show you two. One in lying supine and one doing in side lying. The very nice thing is, when you put your hand on the body, the weight of the body is on your hand. So you don't have to push so much anymore. You only have to lift a little bit. So what we want to do is we go on the level of the spinal processes, or maybe on the transverse processes, and give a very slight lift on the lumbar spine. We do it from L1 to L5 if we want to explore the lumbar spine. In this situation we had a restriction maybe on L2 because we had a listening going there. And by pushing, lifting a little bit on this L2, we can feel different restrictions. If we have a very immediate restriction, the restriction means by lifting this spinal processes, by lifting this spine, is this we have maybe a problem on the facetal level. If we can go a little bit deeper, if we go further than the facetal level, we're on the disc, and we can get an idea about the disc pressure. So if we have a very immediate stop or a very fast stop, it's more the facetal restriction. If we have more a deep stop, it's more a disc pressure. So we're on the level of investigation. On the other hand, we're also on the level of the mobilization. We can already start here now doing follow the listening. So we're on the restricted area, and the body will show us what way it needs to be relaxed, to be released. By bending the leg, I can build in a lever, an extra lever. By doing an abduction and an adduction, it gives also a rotation of the spine. Rotation is always coupled with side bending, so I have a side bending rotation on the lumbar spine. It gives me a possibility to be more precise, to be more exact, especially for the facetal level. This is very interesting. So by using an abduction and adduction, I try to get my restriction more precise, do it with a follow the listening and an induction, and waiting for a release. So if I see it, if we did it now on the by lying supine, I also can ask you to lie on the side. So locate where you have to be. It's always very important to do a good orientation. So we said we give a pressure on the spinal process, or maybe on the transverse process, going a little bit lateral of the spinal process. Again, doing an anterior compression gives you an idea. If you have an immediate stop, it says something about the facetal level. If you have deeper, it tells you a little bit more about the disc. And now we can work again with a little bit more with our levers. So I can put 2 thumbs, but I can also put 1 thumb on her spinal process, giving a pressure in. Doesn't matter where the restriction is, on what level we have, if we have more facetal or more disc. By bringing the shoulder a little bit more to posterior, you get a better contact. And by bringing your thorax more on the pelvis, you have a 3-dimensional system where you're able to control the movements around your restriction and make your follow the listening more precise, or make your release more easier. If that is not enough, we're going to do add another level. And by stretching her upper leg, stretching her upper leg very slowly and bringing it all together, we have an exact monitoring on the level of restriction. Do a follow the listening and waiting for a release. And let it come back. Sometimes you can repeat this a few times till you have the release that you like. And it's only a few possibilities. We have more possibilities. We talked about different levels. So if we have now working on bones, we have spinal process, we have facetal level, also ligaments, and we also can work on the muscles, or on L2. We also have that a nerve level comes. The recurrence nerve, the meningeal recurrence nerve, is able to contact on this level. So we're not going on the spinal process, we're going in the muscle. Try to position the muscle, sometimes bring it more to the spinal processes or bring it a little bit in the deep and bring it more laterally. Gives a stretch by opening this area and again bringing in the rotation. Ask her to work with the shoulder, let the shoulder go more posterior, and again bring also in the leg by stretching it. Yeah? And let it come back. I'm doing a little bit faster because it's a demo. And sometimes you find here a false, very small spot that doesn't feel like a muscle, but it's a nerve. And this nerve has a very big impact on the dura and also on this level where the restriction is. So talking about different levels, we have also a vascular level. We said the maintenance level that we have. Can you turn on the other side? So I have now the left side up. The lumbar vein goes into the renal vein, on the left renal vein. This is very strong on the left side. This contains in the hemiazygos system, azygos, and goes to the heart. If you have a congestion over here in this lumbar vein, this can work very strong on the quality of the lumbar spine. A lot of people have pain in the morning, and sometimes it's because of congestion of this vein. So by releasing this area, releasing this vein, we can get a decongestion of this area, and that sometimes releases the pain or the symptoms. So what do? We said this vein goes to the renal vein on the left side. So by taking the kidney, if we go here inside the abdomen, we feel a pulsation aside of the aorta. We know that we're on the fundus of the left kidney. By putting in my fingers over here, and on the other hand supporting by a finger going into the Greenfeld triangle, by presentating the kidney to my fingers, I do a small lateral movement that gives an elongation of my renal vein, a relaxation on my renal vein, and gives a possibility for the lumbar vein to release as well. So we get a better situation over there. To show you what levels we're dealing with, also a vascular level. We have now a neural level, a vascular level, we had an animation level, we had a stabilization level, we had a bony level. So by combining all these levels, we get the best situation for this area. So, and that is thinking about that we have, if we're talking about new manual therapy, by bringing all these things together and to get an optimal solution for our joints. And that means this also for the other joints of the body. I think we have a very, very good approach, and it's very correct to say that's the new manual approach of the joints. So, thank you very much. This was a short introduction. Thank you, Barbara, for helping me. Hope to see you in the classes. And thank you very much.